Hello, good people. Emmanuel Safali bring you the Promise Insurance Show. And this time around, we want to talk about the medical insurance of what we call the seniors. Let's start with this catchphrase. They say, they took care of you. Take care of them for our J Senior Health Cover. So before going into this, let's just listen to this video on by IRA, the regulator, on what you need to check out for when you're looking out for a medical insurance company. Thank you.
So I urge members of the public, firstly, to engage licensed players. It's very important for you to engage licensed players because we are able to have oversight of how they operate and where they place their monies and what they do with them. So it's very important for you to engage these licensed players as published on our website and also in the newspapers at the beginning of every year. Secondly, it's very important for you to purchase a medical insurance policy. It's for your own good. It enables you to predict your expenses because you don't need to walk around with cash all the time. You don't know when your children will fall sick. You don't know when your family member will fall sick. And often, time and again, we have seen members of the public requesting for contributions, but you never know that when any of these members of the public will not be able to contribute. And so to avoid such scenarios, it's best for you to have a medical insurance policy as a backup. Medical insurance policy acts as a backup for you such that you have an assured partner along the journey, someone to be able to pay your bills. The policy may not pay for you 100%, depending on how much premium you're also willing to purchase. But as long as you're able to have a backup, you're also able to transfer this risk to the insurance company and avoid unnecessary inconveniences. Then thirdly, we have encountered complaints from the public every now and again. So if you're being faced by some challenges with your insurance player, please engage us. But remember, you have to engage the insurance company firstly, and if you fail to resolve a conflict, then you can proceed and report the same conflict to the Complaints Bureau of the Insurance Regulatory Authority of Uganda. We are here to receive the complaints from the public, and then we have the mandate and we have the power to summon the insurance company to explain the why and the how they have done what they have done and how we can resolve the matter together, such that we are able to reach common ground with the policyholder and with the insurance company. Of course, this conflict resolution is also in line with your policy document. So we can't run away from the fact that all operations of the insurance policy are governed by this policy that you sign. So even when we are listening to complaints, we have to do that in line, definitely with best practices and also in line with the policy that you signed as the policy holder. So please read your policy documents before signing. It's very important for you to know what is covered and what is not covered because it enables you to plan and to know what to expect. Do you have a co-payment on a particular benefit? Do you have a co-payment at a certain hospital? It's important for you to know these because you never know when you end up at that very hospital that has a co-payment, and then before you're rushed into the doctor's room, you're requested to pay that co-payment, and yet you won't be prepared if you had no prior information. So it's very important for you to know what is covered within your policy document. But first and foremost, more important than all those things, the insurance policy can only respond when you have done your part and after you have paid your premiums. So please pay the premiums that are due to the insurance company to enable them to be able to pay the bills as and when they fall due. Because without
I think she has been very elaborate. So let's just look into. Of course, we had already looked at this. This is how the flyer looks like. They said they took care of you, take care of them. So this time we want to look at the Just Senior Health Cover and what it entails. And why do we need the Just Senior? Because for the first time, we're covering people above 65 years. Before, as you can see, the population, as per October 2023, there's percentages. We have 1.4% of the population of the 46 million above the age of 60 years. Then below 65 and 69, we have 0.8% of the 46 million. It's a very small percentage. So the percentages keep growing down up to the age of 80 plus. It's still a very low percentage. But these people have been left out for a very long time. That's why I wanted to start with them. But we shall also discuss other medical insurance policies for the people in the younger categories. So this is very important for us to start with. But so let's look at how the policies look like. There are different limits that are entailed in this product. We said you have to look out for what we call inpatient benefits. That's the core and the compulsory package. So we have from bronze to diamond. Bronze, you have a limit of up to 20 million, 50 million for silver, 70 million for gold, 160 million for diamond. And what are we covering for the pre-existing conditions? These are chronic, congenital conditions, existing, not existing, and or diagnosed at the time of joining, subject to full disclosure the time of joining, 6 months waiting period. So there's a 6 month waiting period for this, for existing conditions that they have been mentioned here. That is 7 million covered for under bronze, 12 million under silver, 16 million under gold, and 21 million under diamond. For cancer treatment, for people who have cancer, if it's a pre-existing condition, there's a 2-year waiting period. That is very, that's the only way you can manage to cover you on. In the first year, we can't cover you. In the second year, we have to wait up to the second year. So we keep monitoring, at least within that period, for us to say that we are comfortable to cover you. Organ transplant, also 2-year waiting period. Much as here, the limit slightly increases to 8 million under the bronze package, 12 million, 16 million, and 20 million. Psychiatric conditions under limit, inpatient limit, 6 month waiting period. Of course, if you have any existing conditions, you have to tell us so that we can cover you at least up to 3 million, up to 9 million, depending on the limit. HIV and related conditions, also a 6 month waiting period that is covered. Bed limits, 200,000, 300, up to 600,000, depending on the limit. Then newly diagnosed conditions within the inpatient in the first year of diagnosis, we cover you up to 7 million to 21 million, depending on the limit, on the category you choose. Non-accidental related surgery, this is a waiting period of 6 months, 4 million. This means in case you get an accident and you need a surgery on your mouth or area, they will have to do a surgery up to 4 million to 9 million for that particular one. So there are lots of benefits here. I can't go through all of them. We can, if you're interested, if things like gynecology and prostate surgery, that also requires a 2-year waiting period. Inpatient accident-related treatment, excluding correction of reflective, that is also it also covered 2.5 million to 3.5 million. Post-hospitalization treatment, where there is no outpatient cover. If it has been free utilized, we can cover up to 400,000. That is after you have been discharged, we can cover you within that period, up to 400,000, up to 3 weeks after discharge, 800,000, up to 1 million shillings after 3 weeks discharge. That is for the diamond package. Then local road ambulance to the hospital for emergency, those are covered. Commercial air evacuation out of Uganda must be pre-authorized for treatment, not available or not safe to undertake locally. That is not covered in the first two categories. The first two, that is bronze and gold and silver. Bronze and silver is not covered, but it's covered under the gold and under the diamond package, at least within Africa, that's South Africa, mostly Kenya, India, Pakistan. Those are countries that are covered within under the Jubilee network. COVID extension is also covered. Or if it's only hospitalization, up to 5 million to 9 million shillings, depending on the limit. Funeral expenses, yes, many people fear dying, but death is part of us. As long as you are alive, you know that you will also die one time. So there's also an extension to that of 1.5 million to 3 million shillings. So depending on the limit. Okay, the war is also covered. Now let's go to the outpatient. Outpatient, you are telling you that the limit is 2.5 million and 3.5 million, 4.5 million and 5.5 million, depending on the limit. What are pre-existing conditions, chronic cover? There's a waiting period of 6 months. These are psychiatry, congenital conditions. These are covered, but there's a 6 months waiting period. If you have declared that they're pre-existing, they have been there before. Cancer, same thing, 2 years. We can't cover you within much as you have to disclose to us. If you don't disclose to us, even after the 2 years, we won't cover you. So that's very important to note. HIV, 6 months waiting period, that's also covered within the outpatient limit. Then there are also annual health checks or vaccinations at the centers that the insurer has pre-authorized or has negotiated. Usually, we're going to look at now the limits, the service providers shortly, so that we can know what is which hospitals now to approach when you're doing those annual health checks or vaccinations. Now we're covering up to 400,000, up to 900,000, depending on the category you have chosen. So routine dental benefits, annual limit of 300,000 to 1.2 million shillings, depending on the limit. And benefits, of course, they're talking about the dental consultation and things like that. Routine optical. So routine, now that's for the people who want specs or have any issues with the eyes that are not, of course, accident related. Now, this is 300,000 to 1.2 million shillings. We're covering frames and prescription lenses, name it. But of course, once we give them to you, we give you up to 2 years. You can't change them within the within 2 years. So if you get them in 2024, you'll next get in 2026. Okay. Now this is very key to note. As you have heard the IRA lady, Madam Mercy, she talked about you have to be very keen. Is your policy covering a co-payment element? In some of those hospitals, this has to be declared very in bold, so that you know that for me, my package or what I can afford requires a co-payment. Meaning, this kind of package, if you choose the one with co-payment, you'll be paying 30,000 shillings in such hospitals like Nakasero, IHK, Kampala Hospital, Case Hospital, and Platinum Hospital. So that is for both outpatient and mostly outpatient, not at inpatient. Then you also have an option of no co-payment option, but this one increases your inpatient and outpatient premium by 10%. We shall see that detail shortly. Okay. For general conditions, of course, there's a general waiting period of 30 days for new entrants on illnesses, but there's no waiting period for accident-related treatment. So that is very general for the people who are coming in as individuals or at that advanced age. Then MRI, CT scan on pre-authorization. These are things that are very important when you want to do those CT scans. The hospital you're going to has to inform us. Then fibroids, these are very technical terms, and they tell you that you'll be there's a waiting period of 1 year. Things like fibroids and the cotomy, hypomodotrochomy, tonsillectomy. These are for the tonsilites, name it. Cancer treatment, organ transplant will be subject to 2-year waiting period. Pre-existing conditions, name it. There's a number of things. These are the eligible members. Of course, we're looking at 60 to 80 years. Cancer treatment, we talked about all those are covered. Routine health. Okay. So there are lots of things, but not so big. These are a 5-page document. If you want it, you can look into it. So now let's look at the site providers. Of course, you talked about You have to look at this list. This was a list as of November. It keeps updating almost every 6 months. So we are looking at specialistic, pediatric, OBS, that's obstetrician and gynecology, orthopedics, radiography, ear, nose and throat, dermatology, internal medicine, etc. So this one talks about the area. If it's Bombo, Novi Hospital, they talk about all those kind of hospitals, Gugolovi. It is very key to note. Then you look at telemedicine. You can use Rocket Health. This actually also saves on your utilization because their consultation is just 10,000 every time you call them and they give you treatment. Compared to some hospitals where the consultation is up to about 50,000 to 100,000. General practitioners, specialists on treatment on call. Okay, these are general practitioners. There's a number of them. This list has over 400 service providers all over the Kampala, outside of Kampala, Mukono. You're seeing earlier different outskirts of Kampala are all related here. So there's also laboratory. You have to look at this is at Lancet. If you have any lab issue that is not covered in your hospital, you can go to Lancet. They can give you a prescription to go to Lancet. Then ambulance, there's city ambulance. That is something that was utilized then. Obstetrics and gynecology. These are the specialistic centers that you can use. This is Businje Medical, Sarek Medical Consultation, and then Bethany Women's Hospital in Luzira. Mental, we have also Butalika. Pediatrics. Okay, now of course this one doesn't cover mostly this may not really work so much on the seniors, but still it's also very important to look out for that. Ear, nose and throat, those are the centers. St. Catherine's Hospital, Link, Lifelink, name it. Of course, some people have issues, so there are lots of options. And it's a difference between medical insurance and HMOs. Orthopedics, Kosu Hospital, these are the people with the bones. Dermatology, these are the hospitals available. Urology, this is things with the kidney. Radiology, these are again mostly like lab, but again these are the CT scans and things like that. They are also there. Physiotherapy, the centers are there. Optical facilities, the facilities are there. It's quite a huge document. I can't go into all of it. Then ophthalmology. Now this is like the major eye surgery. You can use Georgina Eye Care Clinic or Mango Eye Clinic. Dental services, facilities, the number of them. I can't mention all. Then upcountry districts. These are named alphabetically. So they start from all the way from Abim, Ajumani, Agago, Apak, name it. Arua, Bujiri, Bulisa, Busheni, name it. Gulu, any part of the country, because this is a cover within Uganda. Kanungu, Kapchora, name it. All these districts, as you can see, because today for the people who are saying that insurers discriminate, no, we're in all parts of the country. Okay, much as it doesn't refuse us to cover you even outside of Uganda. Then pharmacies, we have to look at the number of pharmacies, C&A Pharmaceuticals, there's Novik Pharmacy, there's Onco Pharmacy. This is for cancer-related drugs only. Now let's look at what is the premium. Okay, we said if you chose the bronze, there are limits. These are the limits, the packages under this particular say bronze. Now let's look at package by package. If you start at the bronze, you want to be covered 20 million. For this is a senior person, they will be covered up to 20 million for inpatient in case they're hospitalized. Outpatient for those consultations, the medicines you get, that will be 2.5 million. Dental 300,000 and optical 300,000. Then nurse expense 1.5 million. For such a person, the premium with co-payment, the premium is going to be 2.5 million shillings. Yeah. Then without co-payment, remember that you're adding a 10% on the inpatient and outpatient premium. So this premium is going to increase by about 2.4. I mean, at 240,000. So it's going to reach to 2.7. Then such that now the premium with the taxes is going to be 2.755 million for the whole year. So this is I hope this is very clear. Let's go to silver. We are covering 50 million, 3.5 million, 600,000 for dental and optical, and 2.25 million for the year, in case the person passes on. That's the last expense. The premium for this package is going to be 3.1 million shillings for the whole year, with co-payment in the facilities that they mentioned above, the Nakaseros, the Kampala hospitals, the case, name it. But without co-payment, you will increase to about 3.47 million for the year. Then gold comes to 70 million, the benefits, 4.5, 900,000 and 900,000 for dental and optical, and 3 million shillings for the last expense. The premium here is 3.6 for the co-payment, and then 4 million and 25,000 without co-payment. Diamond is 160 million in terms of hospitalization, 5.5 million. Of course, this is like the major cover that you have to look out for. Dental for 1.2 and optical 1.2, 3 million shillings of last expense. The premium here with co-payment is 3.7 million. So there's a small difference here of about 100,000, but you're getting the benefits almost doubling compared to the gold and diamond. And the premium here, if without co-payment, comes to 4.142 million for the whole year. So again here you can see the small difference of about 120,000, but a big difference in the benefit. So something that you should consider whenever you are thinking of medical for your senior people, the parents and all that, and those who have. So with that said, I would like to remind you to look out for the Jubilee Health Senior Package. They say they took care of you. You take care of them with our Just Senior Health Cover. So let's just conclude with these remarks from Martha, so that we can now conclude with this discussion. Thank you so much.
Without the premiums, the insurance company is also unable to plan for you, and so when they fold you, they might end up paying for you from someone else's premiums. But then it's very important for you to play your part such that we are not inconveniencing the insurance player in making promises to the facilities, and yet you have already received services from the hospitals. So please play your part, pay the premiums such that the insurance company is able to pay the bills as and when they fold you. As health encompasses so many things. So what falls into health might be a hospital cash, might be say a package that will enable you to have access to gyms. So there are different packages that fall under health, because this health is broad. You're looking at someone's health, your health mentally, your health psychologically, your health physically, but medical insurance particularly will look to respond to medical bills, and then the insurer pays the medical facility directly. So after you have gone to the medical facility, your medical insurance policy, the insurer pays for the bills to the hospital, to the facility directly. But for health is broad. It also, if you're looking at subsets, medical is a subset of health. In health, there are other policies where they might pay you, the policy holder, after you have already spent at the facility. They can also pay you for incapacity. You have had a critical illness. They pay you yourself after you have spent, or you have been diagnosed with cancer. You have discovered that you have HIV. So that's critical illness. It's also part of health, but it's not recognized as medical insurance because for it the money gets paid to the policy holder. So medical in particularly, the insurer responds to pay medical bills to the hospital after the policy holder has visited the hospital. That is where the difference comes in.